everyone, ki haal hai? So I just went through a labrum surgery on my left shoulder, and before my surgery, I couldn't find every reference point in India. Hence, I am recording a 1 month post-op recovery journey of myself, which can help anyone who is in need for any kind of information or a reference point. So hi, my name is Ashant Gangwani, and I hail from Madhya Pradesh, Gwalior. I am a national and international overseas county player in the UK. I dislocated my shoulder back in 2022 in the UK. It happened due to lack of stretching in the cold weather. Back then, I was naive and I let it recover on its own, but I did take good care of it. Recently, when I started playing again, it started clicking and popping again. In November 2025, as you can see in the video, it clicked and popped out again, and I felt acute pain. So basically, I heard pop and click sound, because of which I started subluxing my shoulder. Due to continuous pain, I consulted a doctor and got MRIs done, which suggested a signal of labrum tear, and it was later on proven in the clinical test, which was the doctor made me lift my hand, thumbs up, rotate it, get my shoulder diagonal, and I had to push against resistance, which I was not able to do, and was suggested to get it operated to get back to sports. For me, surgery was very critical, hence, I consulted the best three doctors of Mumbai and Pune, and I went forward and I chose one who was not arrogant, heard me properly, really knew what I was looking for, and gave me mental reassurances which eased my anxiety. Before surgery, I got my body checkup done, which consisted of chest x-ray, ECG, and full body blood test. I got admitted to the hospital on 1st June at 8 p.m. and had large drop of water at 11 p.m. and after which I had to stay empty stomach before my surgery, which was supposed to take place at 7:30 a.m. My surgery took place at 7:35 a.m. on the 2nd of June. First, I was taken to the operation theatre where I was given a nerve blocker on my neck, which made my hand go numb. After which, I was chilling with the assistant doctors, and 15 minutes later, I was put on a mask and I was out. Post surgery, I woke up dizzy with my arm feeling like a dead weight. Surgery was successful and they took me back to my room. After 2-3 hours, I started feeling some sensations in my hands and felt a very weird feeling on my fingertips. Initially, the pain was 3 on 10, but as time passed by, the pain became 8 on 10 and I couldn't sleep that night. Next day, I got discharged and I was given medication for the first week, and I was told to do very basic movements, which were bicep curls to make the blood flow continuous in my elbow and my hand. Second was shrugs, and third was scapular tractions, so that I don't fuck up my posture after my surgery. First week was the most difficult one. I was on heavy medications, I was constipated most of the times, pain was 6 on 10, discomfort was 10 on 10, sleep was 2 on 10. I couldn't see properly at all because you had to wear sling 24/7 and it was very difficult sleeping in it. During first week, I also felt coughing, sneezing, yawning, everything in my scar tissue. Second week gets a little better. There were no medications. Not the best yet, but it was better than the first week. I still had to wear sling. At the end of second week, my stitches got off. 3. At the end of week 3, physiotherapy starts. I started with 3 basic exercises. First one was pendulum in forward, sideways, and circular motions. Second was 30-degree deltoid raises on sideways. And third was front forward flexion lying down on bed with assistance of a person. It can be a relative, a doctor, a physiotherapist, or a friend. Currently, my shoulder feels a lot better. I still can't move it very easily, but there is no such pain. I can sleep properly. I'm doing the same exercises I was doing 1 week back. So the target is to achieve 180-degree flexion till 14th of July. It still shivers while yawning, but I can change my clothes now. Now, 8 most important tips for you all out there. First, For the first week, sleep incline. It will make your life a whole lot easier. Take all the pillows you can get your hands on and just sleep incline. Give that rest to your shoulder, elbow, and neck. Second, carry pillow wherever you travel. You are going to feel all the bumps in your shoulder joint while traveling in a car. So carry your pillow, keep it under your elbow, and it will make your life a whole lot easier again. Find a sitting hobby. If you sit alone, you can't do a lot of stuff, so you would need something to do. I started making a lot of videos, learning editing, learning AI, and the basic movements that the doctor told you, that's tip number 4. Do them at least 5 times a day. That's must. You don't want to fuck up your posture. Tip number 5, do walk 3 times a day. You don't want to gain weight during surgery, and it is going to be very difficult. Hence, walk little, slow, but thrice a day. While sleeping, this would be tip number 6. While sleeping, do keep a pillow between your elbow and stomach. It will keep your shoulder in neutral position and not interiorly rotated. 7, stay patient and trust the process. And 8, stay confident. I'm here with you. And if you have any more questions, do ask me in the comment box and I will get back to you. Like and subscribe to see my further journey. And thank you for watching.